The Da Vinci robot, it's a central unit that has 4 arms that are connected. The surgeon places the arms over the abdominal cavity for our purposes and loads instruments onto the arms. The arms, of course, the instruments go into the intra-abdominal cavity, but the working is done by a surgeon who sits at a separate console.
Robotics is a step further beyond laparoscopic to where the incisions are fewer and the movements are essentially a lot more accurate. The older laparoscopic technology, the small incision technology, instruments are rigid, so they do not have wrists. So that's almost like doing surgery with chopsticks. This robotic technology simulates the ability to have wrists inside, so it makes the movements a lot more accurate, and then it can actually scale the movements.
It's almost like operating, as opposed to having your head 2 or 3 feet away, it's like having my eyes right up on the tissue.
It'll actually more accurately move inside the abdominal wall, reducing tension and pressure on muscles and tissues. And so we find that patients are having a lot less pain after the surgery, and that's a great advantage.
The operations that we do mostly relate to the intra-abdominal cavity, things like appendicitis, gallbladder surgeries, hernias. Mostly I tell people everything from about here to here we work on.
I went in for 3 hernias, 1 large one, 2 small ones, and he found 30. I only had 7 small incisions instead of being opened up.
Initially, when an operation begins, I am at the patient's side and I make various incisions and I put little tubes, they're called trocars, in the abdomen, and the instruments go through these trocars.
Dr. Bo said that I'm gonna have a robot to do it, but I'll be operating the robot. So I didn't really worry about it or anything. And we went in and had it with the robot. And I don't have a scar or anything from it.
Dr. Bo explained to me and to my daughter that he would be using a robot. And we kind of looked at one another, a robot. I completely trusted his judgment, and I knew he would be right there.
Laparoscopic procedures usually require 4 incisions to do a removal of gallbladder. But with Da Vinci, it's possible to do it through 1 incision.
It allows us to make smaller incisions, potentially less painful incisions, and do better operations, which makes the surgeon happy, but ultimately the patient, because they'll have better results from their operations.
Some folks think that because it's a robotic, that this is an automated robot that'll do things without control, and that's not true at all.
But the robotic thing is actually an integral part of how the surgeon actually touches the organs. A lot of surgeries that otherwise a surgeon may not be able to perform because of the complexity, with the robotic enhancements, those allow those operations to be done in a much more safe manner and more consistent manner.
But the procedure was better than the complete opening up. It was, a couple of weeks and they were healed up.
I was out of the bed on the 2nd day, and I walked up and down the hall twice. My pain was not really that bad. It was, just, I would say, minimum pain. I was back doing my normal housework and everything quicker.
Having this in York County, I think, is an excellent addition to the hospital. Getting on board at a point where we feel comfortable using the technology as it advances will be, right there along with it, and no longer will patients need to go far and wide to seek out this technology as it progresses.
I really feel that now that I've had the gallbladder surgery, that I'm on my way to being well. I really do. I feel this first time I felt like I'm really going to start to be well.